Hi everyone, my name is Pi-Ming. I'm an associate professor at the School of Nursing, Missouri Western State University. The topic I want to share with you today is the influences of family interaction and the spiritual well-being on elderly's psychological well-being and suicidal ideation. The suicidal ideation in the older adults is a major public health issue. The risk factors of older adults' suicidal ideation, including mental disorders, physical illness, bereavement, and family interactions. Family interactions, according to the previous study, their results indicate the experiences of poor parenting in childhood were indeed associated with increased risk of death at the older ages. Older adults who reported being raised with poor parenting were more likely to report depressive symptoms and problems with social relationships, including less social support, and compared with those who report being raised with a good parenting style. Older adults whose parents use a child monitor, inductive reasoning, communication, involvement, and positive family interaction had a lower score of anxiety and depression. Older adults whose parents use inconsistent discipline, harsh discipline, and negative family interaction had a higher score on anxiety and depression. Spiritual well-being has been shown reduce suicidal ideation and help individual increase psychological well-being. Compared to non-attendee in the religious activities, older people who attend religious activities on a regular basis have a significantly lower level of emotional distress and suicidal ideation. Older adults who had a higher score of spiritual well-being, higher score of faith, belief, life and self-responsibility, and the higher scores of life satisfactions and self-actualization had a lower score on anxiety and depression. So the significance of this study, including the most previous study focused on college students or adolescents. Few studies examine the long-term influences of spiritual well-being and the parenting among older adults, psychological well-being, and suicidal ideation. The research questions: first, what were the relationships among family interaction, spiritual well-being, psychological well-being, and suicidal ideation? How much of older people's psychological well-being was predicted by their family interaction and spiritual well-being? How much of older people's suicidal ideations was predicted by their family interaction and spiritual well-being? The theoretical framework: biological temper, family interaction, and cognitive learning. These three factors will influence a person's personality, and when the stressors come in, they will use different personality, they will use different coping strategies. And the outcome variable will be psychological well-being, suicidal ideation, anxiety, and depression. And spiritual well-being also will influence this process. The methods. This is a cross-sectional descriptive design. IRB has been approved. The questionnaires was used to do the data collection from the community older people in the United States. Total has 90 older adults in the United States. The age range is 60 to 95 years old. The mean age is 72.23. The data was analyzed by SPSS 23. This is the instruments tables. We can see their compound alpha. Compound alpha, if over than 0.7, there is good internal consistency reliability. And we can see all of the instruments over than 0.7, So their internal consistency reliability is very good. This is the table for social demographic data. Most of the participants, 60% were female. The mean age 72.23, and they 61.1% they listen hymn music at least once a week. The diagnosis with the anxiety, there are 27.8% diagnosed with anxiety and 25.6% diagnosed with depression. Their age, their education, most of them 50% were high school. 86.7% were white, 61.1% married, 70% retired, 84.4% believe in Jesus Christ. This is the table, Pearson Correlation. We can see the factors between family interaction and psychological well-being. Family interaction and psychological well-being has positive relationship variable, including child monitor, inductive reasoning, communication, involvement, positive family interaction. These variables had a significant positive relationship with psychological well-being, and negative relationship variables with psychological well-being, including inconsistent discipline, harsh discipline, and negative family interaction. About suicidal ideation, the positive relationship with suicidal ideation, including harsh discipline and negative family interaction, and a negative relationship with suicidal ideation, including the total score of the positive reinforcement is the negative relationship with suicidal ideation. The Pearson correlation between spiritual well-being and psychological well-being. Spiritual well-being, the total score, and the subscale, the three subscale: faith, beliefs, life self-responsibility, life satisfaction, and self-actualization. These variables had a positive, significant relationship with psychological well-being. And we can see all of the spiritual well-being and subscales had a negative, significant relationship with suicidal ideation. The predictor for psychological well-being, including life satisfaction, self-actualization, life self-responsibility, and negative family interaction. This is 3 predictor for psychological well-being. And suicidal ideation, life satisfaction and self-actualization, and the harsh discipline are predictors for suicidal ideation. Conclusion: older people whose parents use child monitor, inductive reasoning, communication, involvement, and the positive family interaction had higher scores of psychological well-being. Older people whose parents use inconsistent discipline, harsh discipline, and negative family interaction had lower scores of psychological well-being. Older people who had a higher score of spiritual well-being, higher score of faith, belief, higher score of life and self-responsibility and life satisfaction, self-actualization, had a higher score of psychological well-being and had a lower score of suicidal ideation. Older people whose parents use harsh discipline and the negative family interaction had a higher score of suicidal ideation. Older people whose parents use positive reinforcement had a lower score of suicidal ideation. The stepwise multiple regression model variables account 73.3% of psychological well-being variance. Life satisfaction, self-actualization, life self-responsibility, and negative family interaction were the significant predictors of older people's psychological well-being. Lower scores of negative family interaction were found to predict increasing older people's psychological well-being. The stepwise multiple regression model variables accounted 34.5% of the suicidal ideation variance. Life satisfaction, self-actualization, and harsh discipline were the significant predictors of older people's suicidal ideation. Acknowledgement and thanks. I want to express my sincere gratitude to Missouri Western State University for support my presentation. My appreciation also goes to all the participants. Thank you very much for your attention and listen this presentation. Thanks.